Welcome to Mind, Health, and You. Have you ever felt uneasy or even scared when looking at clusters of small holes, like a honeycomb, lotus seed pod, or even certain patterns on the skin? This reaction is known as trypophobia, and while it isn't officially classified as a mental disorder, it can still cause real stress and discomfort. Today, we'll explore what trypophobia is, why it happens, and practical tips and treatments to help cope with it. What is trypophobia? Trypophobia is an intense aversion to patterns of small holes or bumps. People who experience it often describe feelings of anxiety, disgust, or itching when they see certain images. It's important to remember, trypophobia is not just being grossed out. For some, it triggers genuine fear, stress, or even panic-like symptoms. Understanding this reaction is the first step to coping with it. Why does it happen? Scientists are still studying the cause, but there are a few leading theories. Evolutionary response. Some patterns resemble dangerous things in nature, like poisonous animals or infected skin, which may trigger a survival instinct. Visual sensitivity. People with trypophobia may have stronger reactions to high-contrast patterns. Anxiety link. Trypophobia often co-occurs with other anxiety disorders, making the response more intense. Knowing that this reaction has a basis in psychology and biology can make it feel less mysterious and more manageable. So how can you cope if you experience trypophobia? Here are some practical approaches. Limit exposure. If you know certain images trigger you, avoid them. Use filters on social media or skip videos with warning signs. Protecting your mental space is valid self-care. Grounding techniques. When confronted with a trigger, focus on something else. Try the 5, 4, 3, 2, 1 method. Notice 5 things you can see, 4 you can touch, 3 you can hear, 2 you can smell, and 1 you can taste. This shifts your attention away from the trigger. Breathing exercises. Deep, slow breathing calms the nervous system. Try inhaling for 4 seconds, holding for 4, and exhaling for 6. This reduces the intensity of fear. Gradual exposure. Some people find relief by slowly exposing themselves to less intense trypophobia images, building tolerance over time. This should be done carefully, and ideally with professional guidance. Mindset shift. Remind yourself, this is just an image. It can't harm me. Cognitive reframing can help break the cycle of fear and disgust. When to seek help, 5:30 to 6:30. If your reaction to trypophobia seriously affects your daily life, like avoiding school, work, or social situations, consider seeking professional support. Therapies like Cognitive Behavioural Therapy, CBT, can help rewire the way your brain responds to triggers. In some cases, medication for anxiety may also be recommended by a doctor. Closing, 6:30, 7:30. Trypophobia may not be widely understood, but your feelings are valid. With self-help strategies and, if needed, professional support, it is absolutely possible to reduce the distress and regain control. Thanks for watching Mind, Health, and You. If you found this helpful, don't forget to subscribe for more mental health insights.